Hi and welcome to Physio Facts. You're watching the interesting facts in physiotherapy, and I am Dr. Alfonso Swami. Today I'm going to discuss something very special. I hope you're going to enjoy this, and let us move on to the video. Yes, before getting into the main video, I wanted you to give simple answers to the pictures shown here, and the answer should be the opposite of the picture. And what is the opposite of standing? I know it is easy, it is squatting. And this is supraspinatus. The opposite of this is infraspinatus. You're right. And now serratus anterior. What is the opposite of this? Yes, the answer is correct. It is serratus posterior. It is absolutely right answer. But why people are hesitating? Because it is not being used commonly. When we studied serratus anterior, that moment we were not in a position to think where is serratus posterior. And it is time to know more about it. Not just serratus posterior. It is two group of muscles, serratus posterior superior and serratus posterior inferior. And the purpose of making this video is started from right now. Among the two groups of serratus posterior muscle, I would like to talk about serratus posterior superior because it has something special to discuss about. Because its referral pain is such that it mimics like a radicular pain, a disc lesion. It may easily mislead an examiner. So it is must to know about this, so I have chosen to discuss about serratus posterior superior. Let us start with the basics of serratus posterior superior. Its origin. It is originated from the spinous processes of C7 vertebra to T3 vertebra. It means 4 vertebral spinous processes. You can see in the diagram it is a 4 band of flat muscle. And its insertion is over the superior borders of the ribs, especially between 2nd to 5th ribs. And you can notice here, its orientation is almost like a rhomboidus muscle, but the rhomboid is attached to the medial border of the scapula. This muscle is not inserted into the scapula itself, but over the rib. And its nerve supply is 2nd to 5th intercostal nerves. And about its function, serratus posterior superior is an accessory respiratory muscle. It elevates the rib. It assists in inhalation, especially during the time of exertion. Means when the person is involved in sports or the person is diseased, something like that, asthma, where you need to cough, the muscle have to get recruited more in these situations. Activation of a trigger point. It means what are the situations that will stress the serratus posterior superior muscle. One such reason is coughing. As we discussed before, when the person is diseased, when he have to cough more, that moment the muscle may get stressed and develop into a trigger point. Otherwise, the position we adapt can leads to the activation of trigger point. For example, it is shown in the figure that arrow is showing that particular girl is sitting with elevated ribs and protracted scapula, and the desk is eventually little high. So the patient will develop trigger points in the serratus posterior superior, and referral pain particular to this particular muscle will be reciprocated. Those pictures are showing the typical presentation of the involvement of serratus posterior superior muscle. Yes, when they develop trigger points, they will have pain deep under the scapula, posterior aspect of the shoulder, posterior elbow, and ulnar side of the wrist. Some patients may also complain of pain over the chest region. Along with that, the patient will have a typical sign of pain in the little finger. This is a hallmark sign of the involvement of serratus posterior superior muscle. Yes, there are so many conditions the patient may have a little finger pain along with the cervical as well as the radicular symptoms. But all these days we are interpreting with disc lesions or cervical spondylosis, all that. Yes, we have to think about that, but we need to add this also: the involvement of serratus posterior superior muscle during exertion, during faulty positions, or when the person is having respiratory problems. These muscles may get stressed and activated into a trigger point, so they will refer pain in this typical pattern. Yeah, deactivation of the muscle. I was concerned mainly about the pain presentation, how it is getting activated, how to diagnose that particular muscle, because we have so many techniques to deactivate the muscle. It is a matter of how to identify the problem. It is not just having the gun in the hand. We need to know who is the thief, and we are knowing right now how to locate the problem and how to shoot out the problem. I wanted to add some additional points here, how to approach this particular muscle. We know it is deep under the scapula. To do myofascial release, ischemic pressure or dry needling, it has to be approached easily. For that, I'll tell the technique. Suppose the patient is having problem in the right serratus posterior superior. Ask the patient to lie on the left side, so that the involved side will be the uppermost, and then ask the patient to touch the opposite shoulder. So that will make the scapula rotate upward and get protracted. That will allow us to approach the serratus posterior superior easily and do the technique and get the result. And this is Dr. Alphonse Aburoswamy signing off. You're watching PhysioFacts, and if you like this video, please share and subscribe my channel. Thank you for watching.